Hello, my dear friends. A very warm welcome to all of you. In this session, we are going to revise all the questions of PSM which are probable to come in your FMGE exam going to happen in July 30 in that exam. I think the session which we are going to discuss today, around 15 to 20 questions will be in your FMGE exam from this session which we are going to discuss. So I have made it and selected the questions which are really important. And along with discussing the probable question for upcoming FMGE exam in PSM, I will also like to discuss the strategy which you should implement and the strategy which will help you to gain more than 200 marks in FMGE exam. Because still 50 days are there, and in these 50 days, if your preparation is smartly done according to the pattern of the recent exams and according to the real strategy, then we can definitely score more than 200. So in the end of the session, we will discuss that strategy and that mindset, that approach, which will give you more than 200 also. So let's start the discussion with the questions based on images in which they can give you the image of mother and child. And there are total 6 programs in which mother and child images are there. So if they give you this logo, and they will not write you Laksh, they will only give you mother and child, or that circular part they can give. So in this program Laksh, what is the work that they do, they can ask in the option. So it is for improvement of facility in maternity ward and delivery room. Improvement of facilities in these two things, maternity ward, OT's labor room. If they give you this photo with white color mother, white color child, that is suggestive of something foreign, white mother, white child. So this is Baby Friendly Hospital Initiative, BFHI. And under Baby Friendly Hospital Initiative, they ask that which of the following is not a main thing under BFHI. So BFHI, remember, it don't focus on prevention of infection. There is no focus on prevention of infection. Because sometimes suppose you are delivering a lady in a forest area or in some hospital where there is no one with you, you are alone. So then we hold the 2 shoulder blade, we put those 2 fingers in the shoulder blade and we support the neck with this finger and we put the baby on the chest of the mother if the baby is crying and all. And we can allow breastfeeding by the mother, and in that duration you can clear the placenta and all. So you can see we are not focusing on prevention of infection. Our focus is on early breastfeeding, early discharge, because early discharge will only occur if breastfeeding has started early. So our focus is on early breastfeeding, early discharge, exclusive breastfeeding, and breastfeeding on demand. Whenever the child asks, mother has to breastfeed. All these are the focus, but there is no focus on prevention of infection. Okay. The next logo in which you can see a mother and child, both are incomplete. So this is for this incomplete program, Pradhan Mantri Matru Vandana Yojana. Matru Vandana Yojana. In this program, government said that they will give 5,000 rupees. 1,000 rupees will be given when the mother will come for first registration or first visit. And remember, first visit has to done at a time of less than 12 weeks. Then 2,000 rupees is given when there is 6 months of pregnancy and the mother has done at least 1 ANC visit. And then the last 2,000 rupees is given when mother come at 6 weeks after delivery with vaccination of DPT, Hep B, which is pentavalent, which include DPT, Hep B and Haemophilus influenza type B. So pentavalent, there are 5 vaccines which is given at 6 weeks. Pentavalent, rotavirus, OPV, FIPV and PCV. So when mother come for all those 5 vaccines, then she get the remaining 2,000. So this program is incomplete because it is not implemented in most of the states. So the mother and child logo is also incomplete. Okay. So 3 logo clear. Now the remaining 3 logo, if there is yellow color mother, yellow color child, This is the logo of JSSY. S stand for Shishu. J is for Janani. Janani means mother. Shishu means, you know na, Sisu means infant who keep on doing susu. That is Sishu. So Sishu means infant. That's why there is mother and infant both in this program. So this is Janani Shishu Suraksha Yojana. And I hope you all know that in this JSSY, there is 3 free benefit in government hospital delivery. The 3 free benefits are, one is there should be free ambulance from home to hospital and back to home. Second is all the treatment and investigations are free. And third is there is free food to mother and 1 attendant. So these 3 things are free. This free food is for 3 days if there is normal delivery. And this is for 7 days if there is cesarean section delivery. And they have asked this question in the past that if there is a poor mother who don't have money to go for hospital for delivery, then which program will help her? So only JSSY can help poor mother without money, because there is one more program, JSY, Janani Suraksha Yojana, where we give money to mother and ASA or Usha after institutional delivery. After delivery, money is given. So in this program, you can see money is given after delivery. So it will not help a poor pregnant mother in delivery. Poor pregnant mother will be benefited by JSSY. Okay. Now, this program with blue color mother and child is UNICEF. Because UNICEF is main focus is on mother and child. So that's why you can see that in this blue logo. One thing I want to tell you in JSY is that they have asked in NEET exam past that what is the money which they give to mother and what is the money which they give to ASA or Usha. And money depends that whether the mother are coming from rural area or urban area. It also depends whether the mother is belonging to low performing state or high performing state. Low performing states are those states in which maternal and infant death are high. And there are 10 states which are low performing. So you have to remember what are the 10 states which are low performing. And it's easy to remember because 6 states are Bihar, UP and MP. And then their brother who were separated from them in 2000. So Bihar brother Jharkhand, UP brother Uttarakhand, MP brother Chhattisgarh. So 6 states is very easy. The remaining 4 states can be remembered by the mnemonic Roja Jane Man, and Roja. R stand for Rajasthan, O for Odisha, J for Jammu and Kashmir, and A for Assam. So in these 10 states, money will be more. It is around double than the money given to high performing state mother. So we have to understand the money, and in the money, we also have to know that ASA get different money, mother get different money. Similarly, in urban area, again, mother will get different money and Usha or ASA, whoever is here, Usha is in the urban area, she will get different money. How much money? Very simple to remember. ASA will always get 600 rupees. Usha will always get 400 rupees. So 600, 400. Now, in low performing state, mother get 1400 rupees. And half of 1400 is 700. So 700 is for high performing state mother. In urban area, mother get 1000 rupees and half of 1000 is 500. But mother never get less than ASA. So she will get 600 rupees here. The question in NEET exam which came from here is, a mother came from urban part of MP, urban MP. How much money to her, how much money to the child? Of course, urban area and MP is in which category? Remember this 6 and 4. So MP is in low performing state. So mother will get 1000 and ASA or Usha will get 400, urban area of MP. If they ask rural area of MP, then the answer will become 1400 and 600 because this is for rural area. Okay, if they ask rural part of, let's say, rural part of Haryana, so Haryana is not a low performing state, so it will be 700 and 600. Rural part of Haryana, rural part of Gujarat, 700, 600 because they are high performing. So like that we can classify and remember it. Just simple remember, ASA 600, USA 400, 600, 400. Then 1400, 700, 1600, 1400, 700, 1600, like that. And then 10 name is easy to remember. So do remember it. Now, there is last logo is this green color logo with mother and child both in green. It is for Anmol. What is Anmol? Anmol is the software given to A&M for data entry. So when this program was launched, most of the A&M in major part of India, they said that very good sir, you are giving us software, but where is the hardware? Where will we put this software? Because computer is not available at most of the sub-center. So they ask, where will we put this software? So this is one program, simple to remember, Anmol A&M software. A&M online is Anmol. So these are the 6 thing where mother and child will be given in logo. Very simple. Green is Anmol, yellow Susu, JSSY, blue UNICEF, white color means foreigner, baby friendly hospital initiative. Then if it is black color, that is Laksh program, which focus on improvement of facility in delivery room. And if it is incomplete mother and child, that is PM Matru Vandana Yojana, 5,000 rupees, 1,000 at first visit, 2,000 at 6 months, and 2,000 after delivery at 6 weeks. So 6 logo, don't confuse, remember it together. Now, this is the logo of Kausal Bharat. Kausal Bharat is same as Skill India, and you can see there are screwdriver and pen on the same hand, so that if you don't get job by using your pen, then use a screwdriver. And in this program, government is giving low cost loan, low interest loan to all the people who want to start business, and they are also giving training to them so that they can start their business. So training and low interest loan are here. Next is this logo where there is a bird which is not flying. Bird with leg is there. So this is India, bird not flying, Atmanirbhar Bharat, self-dependent Bharat. Like most of the students are Atmanirbhar this day, so they are like that, Atmanirbhar Bharat. What is there in this? Again, 2 things in it. First, definitely they will decrease the import of goods so that we can develop our own industry and all. Third is again, second work is again low interest loan. So both of these will be there in Atmanirbhar Bharat. Thank you, dear friends who joined. Dr. Salis, Atul Saini, Bhagya, Dr. Abhi. Welcome, all of you, in this session. Thank you for joining. Now let's learn some of the logo of international programs. This is the logo of SIDA. SIDA, S stand for Swedish. So it is Swedish International Development Association. And of course, the headquarter will be in Sweden. What is the work of SIDA? They ask which organization it fund. So SIDA fund TB program of India. Okay, this logo is of Danida. This yellow color thing is Danida. This lower part is Danida. Upper part is UNESCO. So Danida, full form is Danish International Development Association, Danida. Danish International Development Association. And Danida Fund I program. So how to remember it separately? Very simple. We do नेत्रदान ना, आंखें दान करती हैं. I donation we do. So I दान, I donation. And S is for SIDA, S is for Sputum. So SIDA fund TB program or Sputum program. Danida fund नेत्रदान I program. UNESCO fund the educational scientific work. And this is educational scientific work and all. Educational scientific cultural organization. Scientific cultural work they fund. And mainly they ask where is the headquarter of UNESCO. So headquarter of UNESCO is in Paris, Rome. Okay. Similarly, they can also ask headquarter of other organizations. So Danida is in Denmark, SIDA is in Sweden. We all know where is the headquarter of WHO, in Geneva. And in the same place, we have also the headquarter of International, what is L? It's not International Love Organization, it is International Labour Organization. Then UNAIDS and Red Cross. All these four have their headquarter in Geneva. Not in same building, but in same place. Then they can give you the logo of World Bank, whose headquarter, what is the international currency? Dollar. Why? Because headquarter of World Bank is in Washington, DC, capital city of America. Then they can ask you about UNICEF, UNDP, and UNFPA. So these three organizations are in New York. Okay. Now, what are the other questions which has come from it? First question that they have asked is, which of the organization fund family planning program? So UNFPA stand for United Nations Fund for Population Activity. What does it mean? Fund for population activity. Are they giving money for sex? No. Fund for population control activity. They forget to write control. UNFPA is the one program which fund family planning program. Okay. Then in NEET exam they have asked which organization funds seed and manure of applied nutrition program. Just 2 years back they have asked. So remember UNICEF, which give fund for mother and child. That's why blue color mother child logo. UNICEF fund seed and manure of applied nutrition program. Okay, so applied nutrition program is funded by UNICEF. And in applied nutrition program, they thought that we will open garden in a school where we will produce fresh vegetable. Do you think garden will survive in a school? Very difficult, but they thought about it. So that is there. Now this UNDP, remember, UNDP fund Sustainable Development Goal, SDG, which was given in 2016 and it has to be achieved by 2030. This SDG was funded by UNDP. So based on funding, there are 6 things which you have to remember. Because in one MCI exam, they ask 3 questions from funding. So it became a very important topic. Focus here. 6 questions. First, what does SIDA fund? TB program. Danida fund? I program. Who fund the mother and child program? UNICEF. Who funds seed and manure of applied nutrition program? UNICEF. Who fund family planning program? United Nations Fund for Population Activity, UNFPA. Who fund Sustainable Development Goal? UNDP. So this 6 funding question they ask, and headquarter is not difficult to remember because 4 organization headquarter is in Geneva. 3 organization headquarter, UNDP, UNICEF are in New York. But these UN can get confusing. So how to separately remember them? Focus. South Africa in 1990s, they said that AIDS is not a disease because no one died from AIDS. Most common cause of death in HIV patient is tuberculosis. So South Africa said that WHO has created AIDS. AIDS is not an issue, not a disease. So we can remember this weird thing to remember the fact that WHO created AIDS. So UNAIDS and WHO are in same place, Geneva. Second point, UNESCO, whose headquarter is in Paris, remember? So in Paris, first democracy came, and after democracy, they burned the family member of the king family. They said, now democracy came, what is your role? But they did not burn it in UK. That's why there was queen and all still now. So you can remember this weird fact that they burned the family member and first democracy came there, to remember that cultural, scientific, educational work started from Paris. because first democracy came from Paris. So UNESCO Paris, if you remember, and UN AIDS created by WHO, AIDS by WHO, and UNESCO first democracy Paris. 2 UN you have to remember. Rest all UN are in New York. UNESCO Paris, UN AIDS Geneva, all the 3 remaining UN, UNICEF, UNDP, UNFPA are in New York. So all UN are in New York except UN AIDS in Geneva and UNESCO in Paris. Okay, so like that you can revise all the headquarter. What is this logo suggest? Can you tell me the logo of this organization? Can you tell me this logo? Which organization logo is this? This is logo of such an organization which fund sustainable development goal. Yes, you are right. This is the logo of United Nations Development Program. Where is the headquarter of UNDP? New York. Okay, so this is there. Thank you. Now, next, let's move C. This was the logo of World Bank. And where is the headquarter of World Bank? Yes, international currency, Washington, DC is the headquarter. Yeah, that was not WHO. In WHO logo, there will be a snake and a stick. सांप और लाठी होगी WHO के लोगो में. In the same logo, if you put a snake and a stick, then it will become WHO. Okay? Very good, R. You are right. This is World Bank. Now, this is the logo of Poshan Abhiyan. Poshan. Poshan stand for Prime Minister Overarching Scheme for Holistic Nutrition. Okay. So, P for Prime Minister Overarching Scheme for Holistic Nutrition. What does A stand for? Nothing. It was just coming in rhyming, because if you remove A, it will become Pusan. 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 So they added A there. And in Poshan program, we have 3 main things. One is Anemia Mukt Bharat. And from Anemia Mukt Bharat, a question came in recent FMGE exam, which can repeat again, that what is the target of Anemia Mukt Bharat? Target is reduce anemia each year by 3% as compared to 2015 anemia level. We have to reduce it each year by 3%. Second is, in this PM Poshan is there. PM Poshan is something which replaced midday meal, and PM Poshan come under Ministry of Education. So Education Ministry look over it. Smriti Irani is the Education Minister. They look over it. And when they were changing the name, people asked that, sir, what are the new thing which you are giving in it? Why are you changing the name? So they said that along with school children, previously this program was for school children, but now along with school children, preschool children will also get lunch. Preschool children will also get half protein and 1/3 calorie that they need per day. So this is a very common question. How much protein, how much calorie? Very simple. Most of the part in the rural part, if you know the reality, they eat only rice. So from rice, they can get the calorie, but not the protein. That's why more protein, less calorie. Okay? And KG school children who anyway are getting food at Anganwadi, they were included in it. Government said, so what if they are getting in Anganwadi? We will give them again here. And they were included in this PM Poshan. The last program is Nikchhay Poshan under it. And this Nikchhay, Nik means no, nahi. And Chay means loss of body. Chay, Chay Rog, TB. So Nikchhay Poshan is definitely for TB nutrition. And they have asked it in previous year that how much money is given. So 500 rupees per month is given in Nikchhay Poshan to every TB patient. Why? for nutritious food whole day, है ना, जा सिमरन जी ले अपनी जिंदगी, have 500 rupees per month for nutritious food whole month. But if you divide 500 by 30, it comes 18 rupees. And what comes in 18 rupees? Small gold flake, small tea. But at least something is given. So very less amount is given. But it is given, do remember, 500 rupees per month for TB patient, nutritious food is given. So this is portion, new program, very important to remember. Very good, Sanjay Yadav, you are right. 500 rupees is given here. Now, they can give you an image-based question from identifying gametocyte. The above part is quite clear. I have written it also. It is banana-shaped gametocyte, and banana-shaped gametocyte occur in Plasmodium falciparum. But this gametocyte, people think that again it is banana. No, 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 no. In banana-shaped gametocyte, RBC will be empty. There will be no granules inside RBC. RBC will be like this only, empty part. Banana will be there. But in Vivax, you can see these two type of gametocyte. Vivax gametocyte will have RBC like this. RBC is here, and then it is completely studded in it, completely studded. And within the studding part, there can be nucleus somewhere. But the gametocyte of Vivax is completely filled. The gametocyte of falciparum is something which is banana shaped. Okay? I hope it is clear. Next, falciparum banana shaped, Vivax here. One more question they ask from here in FMG exam is, who make malaria slide? So malaria slide is made by multi-purpose worker, or multi-purpose worker is same as health worker male. So multi-purpose worker or health worker male, they make malaria slide. And the next question in the same exam was, how they make malaria slide? Do they make malaria slide by doing sentinel surveillance, passive surveillance, or active surveillance? So they make malaria slide by active surveillance, because active surveillance is for hidden cases. There are three types of surveillance. Passive surveillance means those patients which are coming to hospital by themselves. Passive surveillance is for notified cases. Active surveillance means someone from the health team will go to the village and will search hidden case. So active surveillance is for hidden case. Okay, and as I was saying, passive surveillance is for notified case which are coming to hospital themselves. Notified case. And if you add notified case and hidden case, if you add active passive, after adding them it becomes sentinel surveillance. And sentinel surveillance is for all cases. For all case we do sentinel surveillance, hidden case active, notified case passive. Okay, and do remember both of these has been asked. MPW make it by active surveillance. Second question which has came from this part in NEET exam was that in the rapid diagnostic test kit for malaria, because we can do diagnosis by two way. One way is health worker making slide by visiting every house in the village in 14 day. 14 day visit every house. You know? Once in 14 day. And when they visit every house, they ask the question, does anybody have fever in the house? If anybody say, yes, I have fever, then they will make two slides from them, thick and thin. And these images are from thin slide. Because in thin slide, we can see the detailed feature of gametocyte. So these are the thin slide, thin blood smear, where we can see such type of image. Now, the question in NEET exam was that there is an RDT kit which is histidine-rich protein is there. So this histidine-rich protein RDT kit, does it detect Plasmodium vivax or Plasmodium falciparum, or does it detect both vivax and falciparum? If you can give the answer, I would love to listen from you. Histidine-rich protein kit. Option A, does it detect Plasmodium falciparum? Option B, does it detect Plasmodium vivax? Option C, does it detect both vivax and falciparum? Please try to give answer. I would like to see whether you know it or not, or you can guess. or you can tell. So this is histidine-rich protein kit. Second is lactate dehydrogenase enzyme rich kit. This lactate dehydrogenase enzyme kit is known as optimal kit. Okay, it is optimal, best. And optimal kit detect both Plasmodium falciparum plus Vivax. They detect both. And histidine-rich protein kit detect only Plasmodium falciparum. This was the question. Okay. So, very good, Dr. Sanjay Yadav and Dipender Singh Chahat for trying. Both of you have given answer that histidine-rich protein kit detect both, and both of you were not correct. Correct answer is Plasmodium falciparum. But at least you tried. And there is no wrong answer in the class. ऐसा शेर भी है कि गिरते हैं सहसवार ही मैदान जंग में, वो तिफल क्या गिरेंगे जो घुटनों के बल चला करते हैं. That means only those who give answer can be right or wrong. And if you are not giving answer, you are not wrong. Anyway, you are not trying for that. Similarly, I have seen that during these last days of 50 days, many students, they start thinking, what if I fail, what if I fail? That means they have surrendered before the war. This is the worst thing which you can do. First fight. Don't be on your knees before fighting. And you have to fight with full strength and just see what happens. Let's enjoy this journey. Let's enjoy this, this preparation and war. You should be approaching the exam with a positive mindset that I will give my best, rest we will see. And the best way to get away from those negative thoughts is replace negative thought with positive thought. Start dreaming about how I will party after exam, how I will go to the medical college wearing apron and all, how I will party with girls and all and boys or all. And if you will replace your negative thought with positive one, and suppose you are feeling bored during preparation, then those positive thought will give you an energy shot again, and you can again sit and study for longer hour. So try to think more and more what will you do after passing, and that will keep you motivated. And if you think with full conviction, it will come into reality also. There is 50 days. We will discuss the strategy at the end. In 50 days, I can bet no matter how worse is your preparation, no matter how shaken is your confidence, you can still clear it. So be ready to fight, and don't surrender before fight. Then one question that they ask is, whose larva is this? So this is Anopheles larva. Because Anopheles, first thing is, Anopheles breed in clean water. That is why Anopheles is known as sophisticated mosquito. Okay, sophisticated mosquito. Second thing is, Anopheles larva, it float parallel to water surface. That's why they are parallel, float parallel to water surface. Rest all the other mosquito larvae, they keep hanging from the water surface. Okay, but Anopheles float parallel because Anopheles have this breathing tube which is useless. Like we also have this useless part now which is hanging below us. What they call it? That useless part which keep hanging below. Yeah, appendix. Hai na? So that is rudimentary. That is very small, functionless. Hai na? So like that here in Anopheles, that breathing tube is rudimentary, functionless. So that's why Anopheles larva has to come on the surface and breathe. It cannot keep hanging because the breathing tube is very small, useless. So it has to come on the surface to breathe. That's why it is parallel. But Aedes culex, they keep hanging. Second thing that they have asked from here, which mosquito have spot on wing? Kiski chunari mein laga hai daag? So do remember, spotted wing is in Anopheles. Because when this question came, all of the students, they answer Aedes. No, Aedes don't have a spot on wing. It is on body and leg, not on wing. So S for sophisticated mosquito, S for spotted wing. Sophisticated mosquito and spotted wing are in Anopheles. And there is one more S there. If you see the image of Anopheles, why they call it Anopheles? Because Anopheles, while biting, it lifts its ano and then bite. And it doesn't bite horizontally. It lifts its anus, it lifts its ass, and then at 45-degree angle it bite. And so you can see the ass in the air while biting, spotted wing and sophisticated mosquito, all for Anopheles, and parallel larva for Anopheles. Okay, do remember it. Now, let's see one more confusing image. This is the image of louse or head lice. And louse or head lice transmit 4 diseases. One is pediculosis. Second is epidemic typhus. Epidemic typhus. Then there is relapsing fever. And there is trench fever. Sorry. So 4 disease is transmitted by louse. Louse, you know na, our childhood friend, head lice. Huh? So how to remember these 4 disease? Very simple. You can remember it by the mnemonic PERT. Why this is the mnemonic for louse? Because remember in our childhood day when we used to take out a lice and kill it, it used to produce a sound of PUT. So the mnemonic is also PUT. PUT is the mnemonic. 4 disease you have to remember. Now a very interesting question came from it in FMGE exam, which even I did wrong when I did it first. Actually, you will read that there is Q fever, which is caused by Coxiella burnetii. Causative organism is Coxiella burnetii. And Q fever is transmitted by air, sometime by soft tick, but mainly it is transmitted by air. So this question came in one of the MCI exams some 4 year back, more than that, that who transmit Quintana fever? I think in 2018 they have asked it, 17 or 18. Quintaniac fever. This was the question. Who transmit Quintaniac fever? One of the option was air. Then there was lice. There was mite. And this was the option. So all the students, including me, I also thought that answer is air. Because we thought Quintana fever, Quintaniac fever is for Q fever. But no. Quintana fever is the other name of trench fever. And who transmit trench fever? Lice. So the correct answer was lice. Why trench fever is known as Quintana fever? Because trench fever is caused by Bartonella quintana. So they call it Quintana or Quintaniac fever. Okay. So do remember who transmit Quintaniac fever? Lice. Okay. And do remember PUT as the mnemonic and lice image. Now, let's come to some other image based question. Can you identify this image? Which diagnosis is here? Or do you like me to revise all the disease of transmitted by insect first? Okay, let's come to image section. In the end, we will also discuss all other disease transmitted by insect. We will revise entomology in a very fluid, very simple way. Okay, in the end. Let's move ahead first. So, what is this appearance being given? That is castle neck appearance. Yes, R, very good. Castle neck appearance, and this occur in niacin deficiency. Niacin deficiency occur when there is tryptophan deficiency, and tryptophan deficiency occur when there is maize diet. Because maize is deficient in 2 things. One is tryptophan, other is lysine. So, maize diet is more in India or in America? Of course in America. That's why this is more in America. And in niacin deficiency, in the recent NEET exam, they have asked about the symptoms of pellagra, that if there is dementia, dermatitis, diarrhea and death. Diarrhea, these three they have given. What is the patient suffering from? So patient was suffering from niacin deficiency. These are characteristic of pellagra. And of course, my dear friend, Dilu Jajada and Dr. R, both are right. You are right. Yes. So do remember it for pellagra. Now, this is one exact question, exact image which came in NEET exam this time. And they asked, this child has history of eating raw egg white. Exact question was there. Eating raw egg white. So what this child is suffering from? Due to eating raw egg white, this child have, can you answer? In raw, what is this child is suffering from? Raw egg white has excess avidine. This avidine binds with biotin and it causes what thing? Biotin deficiency. So this was the image showing biotin deficiency because of eating raw egg white. So it can be repeated again. Similarly, they also of course gave the image of this bow leg appearance, which is by vitamin D deficiency, we all know. They can ask about collagen synthesis defect. Which vitamin deficiency cause collagen synthesis defect? By which vitamin? So collagen synthesis defect is of course by vitamin C deficiency, which cause bleeding gum or scurvy. Okay. So do remember this question which came in recent MCI and NEET exams. Now, can you guess this image? This image has already been asked in MCI exam already. What is this image they are showing? This is the image of dental fluorosis. Dental fluorosis occur if fluorine is more than 0.8 gram per liter. And in one of the MCI exam 3 years back, they asked what is the normal range of fluorine in water. So normal range of fluorine is 0.5 to 0.8 gram per liter. This is the normal range, 0.5 to 0.8. And it's very easy to remember because if they ask the normal range of chlorine, chlorine is 0.5 to 0.7. So chlorine, fluorine both are roughly the same, 0.5, 0.7 chlorine, 0.5, 0.8 fluorine. Now, they can also ask that after doing chlorination of water, how much chlorine should be left in the water? So that is known as residual amount of chlorine. At least this much chlorine should always be present in water, because if this much protein is not there, then chlorination has not been done adequately. You need to do chlorination again. And which device help us to detect residual amount of chlorine, they ask. Residual amount of chlorine is detected by the device chloroscope. And in chloroscope, we have the two tests, orthotoluidine and orthotoluidine arsenide test. So in one of the exam of MCI just 2.5 years back, they have asked that in orthotoluidine test, do they detect free chlorine or combined chlorine? So whether it's orthotoluidine or it's orthotoluidine arsenide, both of these tests, both detect both free and combined chlorine, free plus combined chlorine. They detect both of it. This was the question. Does it detect free chlorine or combined chlorine or both of it? Answer is either it's orthotoluidine or orthotoluidine arsenide. They can both detect both type of component, free and combined chlorine. So then what is the difference? The difference is that orthotoluidine detect it together, these two things, and orthotoluidine detect it separately. Second difference is orthotoluidine arsenide test is using a better reagent, so it is not affected by impurity. That's why the better test is orthotoluidine arsenide. not affected by impurity. It was one of the toughest question being came in MCI exam, and it even confused me when I first saw it. So it's very easy to remember, both detect both free and combined chlorine. Okay, and do remember the image, dental fluorosis. If fluorine is much higher, suppose fluorine is more than 1.5, then it can cause skeletal fluorosis. And in skeletal fluorosis, patient will have brittle bone. So they will come to the OPD and they will say, sir, today morning I was sitting in the bathroom, I had fracture. I was coming up from the bathroom, I had fracture. So what advice will you give to them? Don't go to toilet or do toilet in standing position? No. We will give them advice that do defluoridation of water. That means add lime, alum and bleaching powder in water. If you add these three things, excess fluorine will be removed. This is known as Nalgonda technique of defluoridation. Okay, so by Nalgonda technique, they can remove excess fluorine by adding lime, alum, bleaching powder. Okay, so do remember it. Now, very good Sanjay Yadav, they can detect both. Now, there is two questions in recent NEET exam 2023 which came from this image. That not image based question was there. They gave that in a village there is history of eating local pulses, and after eating local pulses, people are being seen walking cross-legged. People walk cross-legged. You can see in the image, they are walking in a way, their leg are crossing before walking. Crossed leg on toe. So the question which was there is, what is the poison for this? If someone is walking cross leg on toe, what is the poison responsible for it? And what is the treatment? That was the two question. I think you all know the poison. Poison is, can you tell me the poison? Achha, can you tell me the treatment? Treatment is something which was really tough to answer. Poison is BOA. BOA stands for beta-oxalyl aminoalanine, and BOA poison is in neuroletharism. So these people here, they are suffering from neuroletharism. And neuroletharism occur due to eating khesari dal or khesari pulses. So that's why they are suffering from this illness, because they are eating a pulses which is having BOA, which cause neuroletharism. The treatment was surprising. It was vitamin, not B12 or B, it was vitamin C. 500 to 1000 milligram we gave to treat neuroletharism. Now, one question which has been asked 2 times in MCI exam is that someone is eating contaminated groundnut. And after eating contaminated groundnut, these people, they developed hepatocellular carcinoma of liver, of course. And liver cancer they develop. So what is the poison there? Poison is, you should tell it. This you definitely should tell. What is the poison? Very good, Dipender Singh Chahal, you are right. The poison of this image was BOA. You were right. So what is the poison here in case of hepatocellular carcinoma of liver by groundnut? Similarly, they can also ask you that people are eating contaminated wheat or rye. And after eating contaminated wheat or rye by fungus infection, they develop necrosis of finger and toes. So what is the poison here? Necrosis of finger and toes is due to poison ergotoxin. And hepatocellular carcinoma is due to poison aflatoxin. Very good, dear Dipender Singh Chahal and Pankaj Kumar, both of you are right. It is aflatoxin. So, you have to remember it, and it's very simple. We give sumatriptan and other ergotamine group of drug to treat migraine. And how we treat migraine? in migraine, pain occur due to abnormal vasodilatation. So when we give sumatriptan or ergotamine, it causes vasoconstriction. And due to vasoconstriction, patient get relief from migraine pain. Similarly, ergotoxin is also causing vasoconstriction. And that vasoconstriction is leading to necrosis of finger and joint. So ergotoxin, ergotamine will lead to necrosis. And it is in wheat and rye, there is one fungus, Claviceps purpurea, which causes this release of ergotoxin. Okay, so 3 poison here. But they ask question from 2 more poison, which we should definitely revise, because food adulteration is one of the very, very, very important area for FMGE and NEET exam both. You can see 2 questions from here. So we will discuss this Antara, not Santara, very soon. But before that, let's revise those 2 more food adulterant. One is endemic ascites. Endemic ascites is disease, of course, ascites will occur due to eating crotalaria plant, which is also known as junjunia. And the poison here is pyrozolidine. Pyrozolidine. The other disease is epidemic dropsy. Epidemic dropsy is due to the eating of mustard oil. Mustard oil we all eat. So this disease can occur in any one of us. It is not only for exam. Mustard oil contaminated with Satyanasi, destroyer, Argemone mexicana. Okay. You all must have seen the beautiful yellow color field of mustard in Shahrukh Khan movies and all. So in that mustard color field, this weed Satyanasi Argemone mexicana grow, and the seeds of mustard and Argemone mexicana look similar. So sometimes they are being mixed intentionally, sometimes naturally they get mixed, and they release the poison sanguarine. Sanguarine. And due to this poison, they can give you an image-based question here. There is bilateral pitting edema on both leg. So they can give you image of leg of child with pitting edema. How will you remember these 2 separately? Because in my time, I used to get confused in these 2. So to remember it separately, I used to think that imagine you are sleeping with someone of your dream. Go into that imagination. So if you are sleeping with someone of your dream, first thing is you will not sleep. But if you sleep, S is for sleeping. And if you sleep, there will be dropping of the eyelid nerve. There will be dropsy. So sleeping is by sanguarine. Sang and even means together. So you are sleeping together. Sang. Sleeping is by sanguarine poison, which is S is sleeping, and in sleeping there is dropsy. Dropping of eyelid. Sleeping lead to dropsy. And the symptom is also pitting edema. So that is also dropping inside. And pitting edema is also a kind of like dropping inside. So S for sanguarine, S for sleeping, in which there is dropping of eyelid. So sanguarine is poison in epidemic dropsy. And the symptom is dropping inside or pitting inside. Okay, I think you can remember it. Now this is a logo of DAMPA. Depot medroxyprogesterone acetate. And DAMPA dose, you can see 150 milligram. They can ask the dose. Most commonly they will ask the question, for how long it protect? It gave 3-month protection. Okay, 3-month protection by DAMPA. Next question. What is this? This is Mala N. And whether it's Mala N or Mala D, both Mala N and Mala D have same composition. The only difference is Mala D costs 3 to 5 rupees per strip, and Mala N is free of cost. So in Mala N and Mala D, what is the chemical which is there that they can ask? Very simple to remember. Both of them have levonorgestrel 0.15 mg. And they have, oh, it got cut, okay. It have levonorgestrel 0.15 mg. Plus, it also have ethanyl estradiol 0.03 milligram. So this is the composition of Mala and Mala D. Both are normal OCP, and there is one more OCP which you have to know, low dose OCP. Low dose OCP have the same levonorgestrel 0.15 milligram, same levonorgestrel. Both normal, low dose, same progesterone. What is the difference? The difference is that in low dose, ethanyl estradiol is only 20 microgram. In normal dose, ethanyl estradiol is 0.03 or 30 microgram. But in low dose, estrogen is less. This question has came in MCI 3 exam back, that in I pill or emergency contraceptive like unwanted 72 and all, what is the dose of chemical? So this is levonorgestrel, but this time it is 10 times more, 1.5 milligram. OCP 0.15, focus here, 0.15. I pill 10 times more, 1.5 milligram. Okay, do remember. And if I am a female and I came to you for taking OCP, because I am having some live-in relationship also. I actually had live-in relationship for 4 years before marriage. So if I came for you for starting OCP, when will you start OCP? When will you give first dose of OCP? Suppose today is the first day of my menses. And you can see I'm a bit down also because of that. So if this is first day of my menses, you will ask me to take first tablet from 5th day of menses. Because bleeding will occur for 3-4 days. From 5th day, I have to take first tablet. And then I will take it for 21 days. After 21 days, 5th day of menses, I will start. And I will take it for 21 days. After 21 days, there is 7-day ferrous fumarate tablet. You can see ferrous fumarate. And what is the dose of ferrous fumarate? The dose is 60 milligram. 60 milligram ferrous fumarate have 19.5 milligram iron. So this is known as low dose iron tablet, which is in Mala N and Mala D. Okay. So do remember this point. Now, the same thing, you can see Mala D also have the same composition. Levonorgestrel, which is 0.15, ethanyl estradiol, which is 30 microgram because it is normal, and ferrous fumarate same. 60 milligram is the dose, but it contains 19.5 milligram iron. Next question is, this is छाया. तो कैसे लोगे छाया? कैसे लोगे छाया को बताओ? How will you take छाया? It is written here in the image. See it properly. छाया is to be taken पहले 3 महीने में हफ्ते में 2 बार लोगे, फिर 3 महीने के बाद हफ्ते में 1 बार लोगे छाया. ओके, सो फर्स्ट 3 months twice a week, and after 3 months once a week. This is छाया, and it is so simple to remember. छाया is centchroman tablet. So C for छाया, C for centchroman, CC. And this is non-steroidal anti-inflammatory drug, so it has very less side effect. It is developed by Central Drug Research Institute of India. Lucknow has developed it. And we can give it to females in reproductive age group. And do remember that Government of India has this program. Yes, this is the Government of India Family Planning Program, Mission Parivar Vikas. Parivar Vikas means family development. And in Mission Parivar Vikas, government is promoting 2 things. What are they promoting? They promote Dampa, which come by the name of Santra? No, Antara. Antara, plus they will have the, remember, Chaya. So Chaya means centchroman. So Antara and Chaya government is promoting under Mission Parivar Vikas for doing better family planning. Okay, remember, Antara protect for 3 months. this was the logo of older family planning program. जोड़ी जिम्मेदार जो प्लान करे परिवार. A responsible couple is the one who plan the family. But now we call it Mission Parivar Vikas. Okay, family development. This is the logo of NOR plant. This is an intradermal implant in which 6 Cialistic tube are inserted inside and they protect for 4 to 5 years. They will keep releasing progesterone and keep protecting from pregnancy. After this condom, can you identify? Is it male condom or female condom? This is female condom. Okay, have you seen it? Female condom is made up of polyurethane. And female condom have more failure rate than male condom. The female condom has 5 to 2100 women year. Failure rate is higher. Why it is female condom? Because there are 2 rings in female condom. In male condom, which I think you all must have seen, there is only 1 ring and it is made up of latex. But male condom has lesser failure rate, 2 to 1400 women year. Why less failure rate in male condom? Because suppose I am a female and I use female condom while having sex. So now when I am removing female condom, and while removing, if any sperm got a spill, it can go into my reproductive tract and can cause pregnancy. But in male condom, if you are removing it and some sperm get a spill, that will not lead to pregnancy. So female condom has higher failure rate. Now, this is the same logo, Mission Parivar Vikas. This is family planning logo, old logo. Now we don't use it. Now this is Parivar Vikas, holding hand together and all. Can you identify this IUCD? Can you identify this IUCD? What is that? Is it first generation, second generation, third generation? So this is hormonal IUCD or third generation IUCD. Because it is having this plastic thing. Hormone can only be contained inside plastic. There should be some container type of thing, some covering which is containing it. So that's why it is there. And there are 2 examples of hormonal IUCD. One is Mirena, one is Progestasert. Progestasert protect only for 1 year. And Mirena protect for 7 to 10 years. Maximum 7 to 10 years. Usually it protect only for 5 years. So they are hormonal IUCD, and this is copper T 380 Ag or copper T 200 Ag or Nova T or Nova T. These all can be the name. Copper T 380 Ag has maximum protection for 10 years. That's why in all the government program, which IUCD we prefer? 380 Ag. What is 380? They ask. 380 is the area of IUCD in millimeter square. Okay, copper is the metal, T is the shape. These 2, Nova T and 200 Ag, they protect for 4 to 5 years. And they ask this question that what is the commonest side effect of IUCD and what is the commonest cause of removal of IUCD? What is the commonest cause of removal and what is the commonest side effect? So cause of removal is by pain. You can remember it by PR, per rectal examination, like that. Pain is removing it. Commonest side effect is bleeding. Okay. Now, second thing they ask is, this IUCD they will give and they will ask, is it second generation, third generation, first generation? So first generation, I have not put the image here, but first generation is Lipley's loop. They will never ask it. It is like a snake like this. This is Lipley's loop. And the problem with Lipley's loop that there is no point of attachment. इसलिए Lipley's loop से निकल जाता है. Lipley's loop come out quickly and there is no point of attachment. And that's why this Lipley's loop have very high expulsion rate. and due to high expulsion rate, we don't use it anymore. And this is an image of multi-load 375. And this multi-load 375 is also not third generation, it is second generation. Because when we hear this name multi-load, we think there is multiple thing in it and it should be third. No, this is also second generation IUCD, because third generation will have plastic all over it. This is second generation IUCD, and multi-load 375 also protect for 4 to 5 years, same as Nova T and Copper T 200 AG. Okay, and do remember that IUCD has two common problems. It increases the risk of pelvic inflammatory disease and it increases ectopic pregnancy. These two things are increased by IUCD, whereas OCP decreases PID, decreases ectopic pregnancy, and OCP also decreases ovarian and uterine cancer. So OCP decreases four things: PID, ectopic pregnancy, ovarian and uterine cancer. Okay, and they ask what are the absolute contraindication of OCP when you cannot use it. So do remember, OCP contraindicated if there is hepatic adenoma. Very common question. Hepatic adenoma means that LFT is deranged, liver is not functioning properly. Then we cannot give OCP. OCP is also contraindicated if there is history of stroke or cardiovascular disease like heart attack, stroke and all. One more contraindication is if there is deep venous thrombosis, DVT, or history of DVT, we don't use it. Okay, these are absolute contraindication. Of course, one more contraindication is CS cervix, because CS cervix is increased by OCP. In the past, we used to read that breast cancer is also increased by OCP, but nowadays they are not teaching it. So do remember, CS cervix, DVT, stroke, MI, hepatic adenoma, these are contraindication, and these are the advantage of OCP. Very common question, advantage side effect of OCPs. And IUCD, PID and ectopic pregnancy is there. What is the mode of action of IUCD? How IUCD protect? IUCD is spermicidal. This is the main action. It releases copper and all thing in the uterine cavity, and that causes sperm death. Second action is that it make uterine cavity unfit for implantation. But main action written in PARC is spermicidal. Okay, so do remember this part. OCP work by negative feedback mechanism. It decreases the secretion of FSH and all and lead to an ovulatory cycle causing inability to be pregnant. So these are the contraceptives and question coming from it. I hope you will remember it. Now let's read some more program. This is mother absolute affection, and you can see this mother absolute affection. And Ma is a, of course, Government of India program. You can see brown color mother, so it is Government of India. BFHI, baby friendly hospital aesthetic. WHO, white color mother, white color child. Remember, Ma is focusing on opening of breast milk storage center, because if suppose there is I am an HIV positive mother, suppose, and I gave birth to a child, then will I allow breastfeeding in India? Yes, in HIV also breastfeeding is allowed. There is no condition like HIV, TB, in all of these diseases breastfeeding is allowed. But there is chance of HIV. So if there is breast milk storage center, then HIV positive mother child can get milk from there. Other than that, it also promote breastfeeding and early breastfeeding, exclusive breastfeeding, breastfeeding on demand and early discharge. That all being focused here. Now after this, let's read about this new program, Kalank. Sankalank. Sankalank stand, this is a Hindi word which means compilation. So this is simple but just compilation of National AIDS registry data. This is just AIDS registry data which is being compiled from 2017 to 2020. That's all. compile. When we add all the data of National AIDS Registry, and that become a new program, Sankalak. And how it is different from HIV program? The logo of HIV program will have this ribbon only up to here. This is NACO. This is red color ribbon. But if you gave a ribbon like this, which is pink color ribbon is not for NACO, this is for breast cancer. And if they gave you a logo which is purple color logo is for leprosy. So 3 main logo they ask: red, pink, purple. And in Sankalak, the tail will be too long. And you can see this is coming out. Kalank, that is there. Now, what is this? This is the logo of National TB Elimination Program. TB harega, desh jeetega. And in NTEP, what is the target? Target is to eliminate TB by 2025. Sustainable Development Goals said we will eliminate by 2030. But India said, "Arey phekna hi hai to bada pheko." And if we are throwing, let's throw big. So we will eliminate TB 5 years ahead the global target, 2025. Second thing, in TB program, then a new thing is national, one TB health visitor has been created. This TB health visitor, they will visit the village, they will visit the slum area of the village, and they will detect TB cases by active surveillance for hidden cases. So TB health visitor is at 1 lakh urban slum population. One more new thing has been done is that government is providing Nikchay Mitra. Remember, Nikchay means no chai, no TB. Nikchay Mitra, friend of TB patient. They will support TB patient for at least 1 year after treatment end. Up to 1 year after end of TB. Okay, so these are 2 new updates which you have to remember. Nikchay Mitra, TB health visitor in this program. NACO, NTEP. Okay. Now, next logo is, this is Nikchay program. Nikchay started in May 2012, and this is for, this is web-enabled program. So even by mobile and iPad, we can report TB cases. Web-enabled, and the full detail of patient is written. So it is case-based. TB reporting and follow-up program. The question which comes from here is it for private doctor or government doctor, or both government and private doctor? Can you answer it? Very good, Dr. Disrespect. Name is Dr. Disrespect. You are right, breast cancer has that pink logo. And Aryan was also right that third generation is with plastic thing. Mirena and Progesta Cert were third generation. Very good, thank you for answering. So, Nikchay is, it's for private or government? It is for both. So it is web-enabled and case-based TB reporting and follow-up program for both private and government doctors and hospital. For both private and government doctors. Okay. Second thing, that we have Nikchay here, but one confusing program is Nischay. So Nischay is different than Nikchay. Nischay is the urine pregnancy test kit distributed by ASA. Okay, Nischay is to detect pregnancy early. Nikchay is for reporting of TB case by private and government doctors. And this we have discussed, this is Poshan Abhiyan, this is the Nischay kit by ASA. Poshan Abhiyan was 2-week awareness program also on nutrition. So government people will go from door to door and will tell people ki khao be, khate ka hai nahi ho, why are you not eating? Eat. That is 2-week awareness program on nutrition, Poshan Abhiyan. And Nischay is pregnancy detection kit by ASA. As I have said, this is the logo of Anemia Mukt program whose target has been asked, reduce anemia each year by 3%. In Anemia Mukt Bharat, they can ask you the doses of different group and the color of the tablet. So, The mnemonic to remember it is PBR. Just like we go in PVR to watch movie na. Of course, some people go to do other creative work there also. But if you are going to watch movie, do they release movie in PVR once a week or twice a week? Movie is released once a week on Friday. So in PBR, all these 3 tablets given once a week. And P stand for pink here, B for blue, R for red. So pink is given for 5 to 10 year children. The dose is 45 milligram iron plus 400 microgram folic acid. Blue has been asked in one of the exam previously. It is given for 10 to 19 year adolescent boy and girl both. Red is given for 19 to 46 year female, pregnant female, adult female, not pregnant or lactating. And blue and red are given once a week. So the dose of both of it is 60 milligram iron plus 500 microgram folic acid. This is the area from which they ask question in Ops Gynae also, in PSM also. The dose 60 plus 500. Do remember it. And this tablet is given once a week if there is adult female. But the same tablet is same red tablet given for 180 day before and after delivery in pregnancy and lactation. The only group which is left is children. And in children, we have to give the low dose. So to give the low dose, we divide the dose into 2 halves. That's why we give it twice a week. Twice a week dose is given in children who are between 6 months to 59 months. What is the dose which we give? Twice a week, 20 milligram iron plus 100 microgram folic acid. It is given by 1 ml IFA syrup. And it is simple to remember. If you multiply 20 with 5, it will become 100. So 20 iron, 100 folic acid, twice a week it is given. Okay. So this is the doses. Do remember, for adolescent, it is blue color, once a week, PBR once a week, 60 plus 500 microgram. And in pregnancy and lactation also, same dose is given, 60 plus 500 microgram. Okay, do remember it. Now, there are 6 things which we will give in it. One is iron folic acid supplementation. Second is deworming by, of course, albendazole. And this albendazole is given biannually, twice a year. On 10th of Feb, we have the National Deworming Day. And then we give it, second is given on 10th of August. So 5 days before Independence Day and 4 days before Valentine's Day. If you met someone 4 days before Valentine's Day, what will you give to them? 1 tablet of albendazole. And of course the person will ask, ये क्या पगला गए हो क्या? ये tablet खिला रहे हो, क्या इरादा है? क्या करना चाह रहे हो? है ना? So then you will say कि I am giving this tablet to kill the worm inside you. तुम्हारे कीड़े मारने के लिए दे रहा हूं या दे रही हूं. So 4 days before Valentine's Day, what comes? Is it hug day? Some day is there. So do remember, 4 days before it is the National Deworming Day. And I think some day, so it's there. Anyway, now, solid body, smart mind. This is the logo of this Anemia Mukt Bharat program. And this is one advantage also. The advantage is behavior change communication. We will say it to the mother that your child will be smart, come first if you take the tablet, and she will take it, a smart mind. We will say it to the child that you will be able to fight with all the children of the street. Solid body. So this way we can make the mother and child take it. That's why it is solid body, smart mind. The fourth is that we will measure anemia and we will follow up the cases using digital HB measurement. Fifth is that we are putting iron fortified food. We are mixing iron in food, trying to mix it at least. Just like we mix iodine in salt or vitamin D in vanaspati ghee and all, we add iron here. And last benefit is we focus on other benefit of other causes of anemia also. Like one major cause is fluorosis. If fluorine is high in water, it can cause anemia. Second is malaria can cause it. Thalassemia, sickle cell anemia can cause it. So we will focus on those causes also. So what are the 6 benefits? IFA, albendazole, BCC, then food fortification, digital HB measurement and follow-up, and focus on other cause also. These are the 6 benefits which we have. So do remember, Anemia Mukt Bharat is a 6x6x6 strategy. कुल मिला के बड़ा ही छक्का program है. This is Anemia Mukt Bharat with 6 group. We help by 6 strategy, by 6 intervention, and for those 6 intervention we have this 6 strategy which you need not to remember. Main thing you have to remember 6 benefit and what are the dose of IFA given to 6 group. Okay, chalo. Now what is this? This is Kilkari. What is Kilkari? The first cry of the child is Kilkari. This is mobile based application. Government will send recorded messages to the mother. She will listen to the message and she can take care of the child. So easy. That is Kilkari. Next is this question which has been asked in one of the MCI exam. This is logo of Bureau of Indian Standard. They have not written it below, of course. BIS, Manak Path Pradarshak. You can see this logo on gold jewelry and in silk sari. This is the logo. This is the logo of MOHFW, Ministry of Health and Family Welfare. Arogya Sukh Sampadam, Padam, Padam. What does it mean? It means in good health lies all happiness and wealth. So we should focus on it. It's not Ministry of Ayush. This is Ministry of Health and Family Welfare. This is a very creative logo. Can you guess which organization or which program logo is this? This is the logo of death and birth registration. This black color is the death. And this green color with red thing coming out, that is the birth. So death and birth registration, this has to be done within 21 days. This registration has to be done. And they have asked this question that where do we register birth and death? These are registered at PHC. Where do we register marriages and all? So marriages we can register at sub-center. And within how many days an outbreak should be reported from a PHC? So outbreaks should be reported from within 24 hours. Outbreak reported in 24 hours. Okay, and what is the first step in outbreak investigation? Suppose in your hostel, when you came, you found that 5-6 friends of you are having charchari, loose motion. What is the first thing you will do to investigate that outbreak? What is the first thing you will do? First thing is you have to collect the sample and take it to the lab for confirmation. Because if it is cholera, you need to vacate everyone, give doxycycline capsule 100 mg 3 times a day for 3 days to everyone. If it is typhoid, you will treat with ciprofloxacin. If it is gastroenteritis, you will treat with metrogyl. So it all depends on diagnosis. That's why the first step is confirmation of diagnosis. Okay, do remember it. Now, next is this blue color circle. This is for diabetes awareness. Before moving ahead, I would like to tell you 2 important questions. One is the question from, they ask reference male and female, their weight. And I am moving to dietary part and discussing this small 2-3 question here. What is the weight of reference male and female, they ask. Reference male weight is 65 kg. Female weight is now moved to 55 kg, 5 kg more. Height, if they ask, it is 177 centimeter for male and 162 centimeter for female. So the difference in height is 15, difference is weight in 10 kg. Okay. Second thing they have asked in recent MCI and NEET also, both exam they have asked that what is the difference between what is EAR and what is RDA. And when it came in MCI exam, then I was recording a session for NEET exam, and in my first slide I told every student that this question is going to come in NEET also, because whatever they ask in MCI, from that 2-3 questions come in the same NEET exam. And actually this was a question in NEET exam, and so my guess was correct there. RDA, because the topics are common, so it's very easy to guess things. RDA is recommended dietary allowance. This recommended dietary allowance simply means the amount which we need to eat to fulfill the need of 97.5% of population. Okay, fulfill 97.5% population need. What is EAR? EAR is estimated average requirement. Estimated average requirement is needed to fulfill need of 50% population is fulfilled. So that means which one will be bigger? RDA will be bigger or EAR will be bigger? Always recommended dietary allowance will be bigger than estimated average requirement. RDA will be higher. And what is the RDA of calcium that we need? They ask. RDA of calcium in pregnancy is 1000 milligram. In adult male and female also it is 1000 milligram. In lactation it is a bit more, 1200 milligram. And in MCI exam they have asked what is the need of calcium in old age, that is also 1200 milligram. So do remember, pregnancy 1000, of course more is needed in lactation, and similar dose in old age. Okay, so that is there. Now this is the logo of ESI scheme. From ESI scheme 3 questions we should know. First, what is the contribution of different people? 0.75% is given by employee. Because this is an insurance, for every insurance we need to pay some premium. So premium 0.75 from employee, 3.75 is given by employer, 1/8 is given by state government, and 7/8 by central government. So in our time they used to ask who give 1/8, who gave 7/8. 7/8 by central government. Very simple to remember. 0.75, 3.25 if you add it will become 4%. 4% by employer. 1/8 means 12.5%. And 7/8 means what is left, that is 83.5% come from central government. So who is the main funder? Central government is the main funder of ESI scheme. Second question they ask is that they give some benefit. The first benefit is sickness benefit, which is given for 91 days, and it is 70% salary which they give. But question has came in NEET exam from extended sickness benefit. Okay, this is sickness benefit. Extended sickness benefit is for 2 years with 80% salary. Why more salary here? Because extended sickness benefit is given for 34 registered disease in which patients are very severely affected, like TB, leprosy, empyema, and HIV and all. So in these serious disease we give it, so we give it more salary and 2-year leave. They can confuse you with enhanced sickness benefit. Enhanced is slightly similar to extended, so pay focus here. Enhanced sickness benefit is given for 7 days and 14 days. Why? To cut the wire. 7 days for vasectomy, 14 days for tubectomy. And how much salary is given in them? Of course, 100% of salary, because you are doing it for the country. It's a full salary. Question which came in recent MCI exam was, what is the duration of leave in maternity benefit? Option are 24 week, 26 week, 28 week or 30 week? What is the duration of maternity benefit they ask? Can you answer this question? Because it came in last MCI only. How much? 24 week, 26 week, 28 week, 30 week. What is your answer? Please, my dear friend, try to answer it. How much is the week of that? Very good. My cute buddy student here has replied 21 days is the registration time for birth and death. Very good. Within 21 days, you have to register birth and death. Dr. R is saying, "Aap nischay hi pregnant ho." He detected my pregnancy also. And not nischay, not TR. Very good, Apurva and my cute buddy. It is 26 week. The duration is 6 month or 26 week. Okay? Chalo. Now, if you want to quit cigarette, give a missed call on this number. Give it right now. If you will give it, government will call you again and again so that you quit. What? Mobile phone. That's why it is M cessation. No. Of course, do you think it is easy to quit cigarette by just getting called by someone? Not so easy. But government is thinking that this is M cessation program. If anyone want to quit cigarette, they will get recorded messages again and again and they will quit it. Do you think it is so easy to quit? It is easy. I already quit cigarette. It is really easy to quit cigarette. I have already quit it some 52 times by now. It's very easy. Not difficult. Anyway, this is Mobile Academy. What does it mean, Mobile Academy? This is an online training program for ASA. ASA will get training on phone. She will get recorded messages. ASA training duration is 23 days. So for 23 days, she get trained, but in this, she will just listen to phone and she will get trained. And so that is Mobile Academy. Now, there is two controversial questions which they ask again and again. One is, what is the number of ASA per 1,000? Second is, what is the educational? So do remember, it is 1 ASA per 1,000. This is the updated information because it is written in PARC in 3 places, and in the latest guideline of National Health and Family Planning Health and Wellness Center, they again mentioned 1 ASA per 1,000. Please do not get confused here. Second, what is the minimum education criteria of ASA? So minimum education is not 10th. Minimum education is 8th pass. Again, this has also been written at 3 places in PSM book. If you want, I can show it from the book directly because I know you will be confused in this part again and again. So let me show it there. See, this is one place. Okay, I need to rotate it. So let me show you the other image. Oh, this is also this one place. This also need rotation. But it is 8th class written here. And which 8th class is here? You can see 8th class. Again, similarly in the second image also, it was written again with formal education up to 8th class, you can see. So 2 times it is written 8th class and 2 times it is written 1 ASA for 1,000. Okay, again and again they have written it in PARC. Don't get confused. It is always 1 ASA per 1,000 and minimum is 8th. We prefer 10th pass, but minimum is 8th. They have asked it in MCI exam previously. So don't get confused in this information. Who select ASA? She is selected by Gram Panchayat. Who gave training to ASA? Training to ASA is given by ANM and Anganwadi worker. So she get 23-day training by ANM, which is health worker female. Auxiliary nurse midwife is the same as health worker female. And ANM and Anganwadi worker, they give training to ASA. Okay? And do remember that ASA and Anganwadi don't do 3 work. ASA and Anganwadi worker, they don't make malaria slide because that is made by MPW. They don't uh, conduct delivery theoretically, and they don't give vaccine theoretically. Practically they give all the vaccine, but theoretically these three are not the work of ASA and Anganwadi. So if you remember what are not their work, you can easily answer what are their work. Okay, so do remember these three important point, and this two also, and don't get confused here. But ASA is paid for vaccination. She don't give it, but she is paid as motivator. That is why ASA don't get paid for 3 vaccine. What are those? Don't get paid for OPV, BCG, Hep B. Why? Because these are given at birth. And at birth, mother and mother-in-law are in hospital. So whom the ASA will motivate? Sasurji, father-in-law. No, no. There is no one to motivate at home. That's why ASA don't get paid for this vaccine, but she is paid for all other vaccine other than these 3. Okay, so do remember this important point. This is the logo of Anganwadi program. Anganwadi is at a population of 300 to 800 in hilly area and 400 to 800 in plain area. Anganwadi come under ICDS program, Integrated Child Development Services program, and ICDS come under Ministry of Welfare. Ministry, now it is known as Ministry of Female and Child Development. They look over work of Anganwadi, and of course an Anganwadi worker, she get 4-month training and she had a fixed salary. ASA don't have fixed salary, but Anganwadi have fixed salary, and the fixed salary is minimum at least 1,500 rupees per month. Most of the state give more than that, but minimum is this. And who select Anganwadi? Again, she is also selected by Gram Panchayat. And up to which year children come to Anganwadi? It's not 5 year. Anganwadi look up to 6-year children. Okay. Then, after this 4-month training, who does as Anganwadi worker report? So 25 Anganwadi worker report to one supervisor. Supervisor is known as Mukhya Sevika. Mukhya Sevika, main servant. And this supervisor, they report to 4 supervisor report to 1 CDPO, Child Development Program Officer. So that means under 1 CDPO, around 100 Anganwadi worker comes. Okay. Now, of course, you know that in Anganwadi we get food. In that food, they ask how much is the protein that is given per day, how much is the calorie that is given per day, and who get what. So, first are all the normal children who are less than 6 years. The normal child, they get 500 kilocalorie per day. Then there are all female. They can be pregnant, lactating, adolescent and all. They will get 600 kilocalorie per day. And last is malnourished child. Normal child and malnourished child, they will get different nutrition. Normal child 500, all female 600. And because it is malnourished, it should be 700, but we give 100 extra, 800 kilocalorie per day. And so how much kilocalorie per day? 500, 600, 800. How much protein per day? Very easy to remember. 15, 20, 25. 15, 20, 25 gram protein, and 500, 600, 800 is the calorie per day. Okay. So do remember this point about Anganwadi worker. In NEET, they have asked one question, that in a village, people, pregnant female, they are not eating papaya, mango, because people say that papaya can cause abortion. So who will screen the mother and who will send them to higher center? Is it ASA worker, Anganwadi worker, or A&M? Answer was ASA. ASA has this duty to visit the home, check for any sickness in mother before and after delivery, and refer them to higher center. So ASA will see the house of the female and will refer the child to higher center, child and mother or mother to higher center, not Anganwadi worker. Okay, this is ASA duty. Do remember. Now, next question. This was the older midday meal. Now midday meal is no more. It is known as PM Poshan now. Pradhan Mantri Poshan program, and it comes under Ministry of Education. Remember, half protein and 1/3 calorie is given per day. है ना? चलो. Now this question has been come. Health in your hand. आपका स्वास्थ्य आपके हाथ. क्या मतलब? आपके हाथ आपका स्वास्थ्य. क्या मतलब? It means don't smoke, don't drink. You will not develop cardiovascular disease and all. This program is for how many diseases they have asked in MCI exam. It covers 4 diseases. They have asked which disease is not covered under NPCDCS. So NPCDCS look for 4 diseases: diabetes, heart disease, stroke, and cancer. Cancer, diabetes, cardiovascular disease, stroke. Okay, 4 diseases which come under NPCDCS. Now let's revise some very important question which they have asked in past. What is the most common cancer in male of India? Can you answer it? Try to answer it if you know. What is the most common cancer in world? So in world, what is the answer? Lung cancer or breast cancer? Answer is breast cancer, not lung cancer. Why? Because there is this formula that prevalence of any disease is equal to incidence multiplied by duration. Incidence multiplied by duration. Duration means for how long people are suffering. And in breast cancer, we all know people suffer for 5, 10, 20 years. So at any time, if you see all the old plus new case, for breast cancer, old plus new case will be very high, prevalence will be very high. Why? Because people suffer for longer time. Because they suffer for longer time, at any time their prevalence, their burden will be highest. So, and in lung cancer, people die within 1-2 years of diagnosis. So lung cancer has very low prevalence as compared to breast cancer. आप समझ रहे हो बात को? ब्रेस्ट कैंसर के लोग लंबे समय तक उसी से जूझते रहते हैं. तो अगर किसी भी एक समय हम पूरी जनता में जब केस देखेंगे तो ब्रेस्ट कैंसर कई गुना ज्यादा होंगे क्योंकि उनके मरीज बचे रहते हैं, मरते नहीं हैं जल्दी. And a lung cancer patient, they die quickly, so their number is less. But breast cancer number is very high. This is written in PARC in a table, so please trust on this data. This is correct data, and data collection from population is work of PSM. Okay, so focus here, rely on us. In contraceptive, rely on gynae people. But in data collection from people, rely on us. This is breast cancer, don't doubt it. What is the most common cancer of male in India? Very good, Veer Singh, you are very Veer, and my cute buddy is also right. That is oral cavity cancer for Indian male. क्योंकि ऊंचे लोग ऊंची पसंद मानिक चंद और बोलो तो बोलो जुबां केसरी. क्योंकि मुंह में रजनीगंधा तो कदमों में दुनिया है ना. So due to tobacco product chewing, we lead to oral cavity cancer maximum being asked. Now, third question, what is the most common cancer in male of world? If they ask male of the whole world, so male of world they ask, then the answer will be lung cancer because they are smoking a lot, so lung cancer. And if they ask most common cancer in female of India, what is the answer? Is it cervical cancer or breast cancer? Again, the answer is breast cancer, dear, because of the same concept that if the female have breast cancer, she will suffer longer and their data will be more at any time. But cervical cancer patient, they die within 1 to 2 years of diagnosis, so their number will be less. Don't doubt it. Most common cancer in female of India is breast cancer. In male of India, oral cavity. Overall, it is breast cancer, which is most common. Okay, so do remember this 4 point, which we need to remember here. Very good, my cute buddy and Dr. Aftab Pasa, you both are right. It is breast cancer. Dane dane mein kesar ka dam. Very good, Veer Singh. Aha. Now, after this NPCDCS, but before moving ahead to this program which I have written, let me ask you this question which came in MCI exam already, and in INICT also, and NEET also, all have asked that if a drug does not cure disease but prevent death from it, what will happen to prevalence and what will happen to incidence? They will give option like prevalence increases, decreases, remain same, incidence increases, decreases, remain same, like that. So first thing is, whenever they talk about a drug do not affect incidence significantly, incidence remain almost same. Why? Because new cases can only be prevented by preventive and social changes. For example, if you want to decrease, suppose we found a new drug to treat diabetes, hypertension, will the new case will stop coming? No. New case of diabetes, hypertension are coming due to smoking and alcohol and other thing. Na? So it needs social change. It needs prevention method. Okay. But what will be the effect of that drug on prevalence? The formula we just read, prevalence is incidence into duration. And let's say if a new drug is found which, like hypertensive and diabetic drug, they are preventing the death from it. But are they curing the patient from diabetes, hypertension? क्या hypertension sugar का वो जड़ से इलाज करती हैं दवाइयाँ? नहीं ना, वो बस मौत को रोकती हैं. So a very good example can be hypertension diabetes drug, which is not curing, only preventing death. So if they are preventing death, people will suffer longer, and because they will suffer longer, prevalence will be higher. क्योंकि ज़्यादा देर तक डायबिटीज और बीपी के मरीज सफ़र करते हैं, इसीलिए एक समय में, किसी भी एक समय में उनकी नंबर ज़्यादा होते हैं. Because they suffer for longer time, so the prevalence will increase. So do remember, if it does not cure disease, prevent death, prevalence increase, incidence same. Similarly, they can ask a second question here, that if a new drug cure disease quickly, now it is curing it quickly. So now what will happen on prevalence and what will happen on incidence? Try to think and answer. First, definitely it is incidence, so drug will not affect it, so incidence will remain same. But what will happen on prevalence? Can you answer it? Here, because the new drug is curing disease quickly, so people get cure quickly, so the duration will be less. And if duration of disease is less, prevalence will also be less. So prevalence will decrease, incidence remains same. Okay. Remember, my dear friend Aftab and all other my dear friends who are listening, that even in urban area in female, most common cancer will be breast cancer only. Because I explained this formula, prevalence, incidence into duration, they will suffer longer, so their burden will be higher. Most common cancer in female of urban area, rural area, India, world, all four answer is breast cancer. And most common cancer of the world, breast cancer. Only two answer is different. Most common cancer in male of world, lung cancer. In male of India, oral cavity. Okay. Rest all time answer was breast cancer. Now, please believe on this. There is given on a table in park. I can show you the evidence that is there. Okay. Chalo. Now, very good, my cute buddy and Dr. Aftab and Dr. Raghav, you all are right, and Veer Singh, you all are right. Prevalence will decrease. Now, this logo here, This is the logo of India Newborn Action Program. You can see a child sleeping now. So this newborn program is trying to decrease infant death. And to decrease it, they open one bed for infant. One warmer, you can say, one infant bed at PHC, which is known as Newborn Care Corner. Then there is 6 infant bed at CHC, which will be known as Newborn Stabilization Center. Okay. And under this, there will be 12 bed for infant at District Hospital, Jila Aspatal. And this is known as a Special Newborn Care Unit. So how will you remember it? Care, first we give care at PHC 1 bed. Then we stabilize the child, stabilization 6 bed at, after PHC comes CHC. So PHC is 1 bed, CHC 6 bed, District Hospital 12 bed, 1 6 12. Care, stabilization, special care. Okay, like that you can remember. But this is not being asked till now. It's a rare question. So if you can, it's okay. If not, it's okay. So this is the logo of INAC program where we try to decrease the infant death. Okay. Now, next is Chirayu. What does Chirayu means? Chirayu means longevity, long age. This is the logo of Rashtriya Bal Swasthya Karyakram. And how will you take care of your बाल? कैसे ख्याल रखोगे बाल का? तेल लगा के? No. In this RBSK, we are trying to give good health to our children by combined effort of ASA, Anganwadi worker and Ayush doctor. ASA will visit the mother at the home till 42 days of delivery. She will visit, and even after 42 days till 6 months, ASA will visit the home and will look for things. Anganwadi worker will look between 6 months to 5 years. No, 6 months to 6 years. And Ayush doctor also visit Anganwadi and government school. So when they will visit Anganwadi and government school, they will screen children for 4D. And after screening, they can treat them or they can refer them. So what are the 4D? One is deficiency disease. Other is defect since birth, congenital birth defect. Third D is developmental anomaly. Like if someone have congenital Talisep's equinovirus or cleft lip, cleft palate. Cleft lip, cleft palate will come in defect since birth. Congenital Talisep's equinovirus will come under developmental anomaly or disability. And last D is, this is 1, 2, 3D. The 4D is disease of childhood. बचपन की बीमारियां. Okay, disease of childhood. So they will screen for 4D and they will refer to higher center. So the question which come from here is, which disease do not come under RBSK? Congenital glaucoma, retinoblastoma, cataract or corneal opacity. So to answer such type of question, you have to think that Ayush doctor is going to Anganwadi with just a steth and all. So all those diseases which cannot be seen by naked eye cannot come under it. So remember, these two diseases, congenital glaucoma and zinc deficiency, these two diseases don't come under RBSK. Because there is a list of 30 diseases under RBSK, and in that 30 diseases, they have not written congenital glaucoma or zinc deficiency. For these two, we need more tests. It cannot be diagnosed by naked eye easily. And only 10% case you can diagnose it by naked eye, but rest we need diagnosis. We need further confirmation. One more question. which is very important and came in recent NEET exam from this part, is that if a child is coming with dry skin around mouth and nose, what this child is having. So this is the symptom of acrodermatitis enteropathica. And acrodermatitis enteropathica occur in which deficiency? Zinc deficiency. So this is the very important question to remember. Dryness around mouth and nose. Now, this is Kishore Swasthya Karyakram. Kishore means, not Kishore Kumar. This is adolescent. What is the age group of adolescent? 10 to 19 year. And government think they play kite. Wahi peche ladate hain na. They are the one who are king. So in this RKSK, we have separate OPD for adolescent, which is known as adolescent friendly health clinic. And we have adolescent reproductive and sexual health program, in which school teacher try to give them try to give them sex education and will teach them about menstrual hygiene and all. So this is two things under RKSK, sexual health and friendly clinic. Okay. Oh, this is Pradhan Mantri Surakshit Matritva Abhiyan. This hand which is coming out, it is the hand of Pradhan Mantri himself. Modi ka haath hai na. So what they do in this program? This is Pradhan Mantri Surakshit Matritva Abhiyan. Surakshit means safe. Matritva means motherhood, of course. Abhiyan means mission. So in this program, 9th of every month, there will be free ANC checkup. Free ANC checkup, investigation, treatment. Where? In government hospital, all these three will be free. On which day? On 9th of every day month. Okay. But this is, suppose you forget to bring the mother on 9th and you bring it on 10th, then what will happen? Nothing. It will be free on 10th also. This is free on any day of the month in every government hospital all over India under the program JSSY. Remember Janani Shishu Suraksha Yojana? All these three things are free for infant and mother in all the program, in all the month. So what government is giving on 9th? Nothing. But they launched this program. This is PMSMA. Second thing in PMSMA is they gave the color red color for high risk pregnancy, under which anemia come, of course eclampsia come, all the comorbidity comes, 14 disease come under, 14 things come under it. That is red. Then there is blue color. Blue color is for pre-eclampsia in pregnancy. And then there is yellow color. Yellow color is for pregnancy with comorbidity like diabetes and all. Comorbidity. And then the last is the green color. Okay, green. Green color is for normal pregnancy. So they classified the pregnancy and they free things on 9th of every month. That is PMSMA. Do remember it. Okay. So this PMSMA, it comes under Suman program. Suman stand for Surakshit. SU means Surakshit. Surakshit means safe. M is again for Matritva. A is again for, but AN is not for Abhiyan. AN is for Aswasan. Aswasan means assurance. All is well, all is well, all is well. So Suman program is a recent program. Focus here. Suman program said that for Surakshit motherhood, Surakshit Matritva Aswasan, hai na? Matritva Aswasan. For safe motherhood assurance, government said that there should be zero denial in government health setup, government hospital to mother. And zero denial in government hospital for maternal facilities, for maternal health facility. they forget to write if available, है ना, zero denial to maternal health facility if available in government hospital. And under this Suman, one program come is PM SMA. So first thing which was launched was a Abhiyan mission. That was PM SMA. But in next 7-8 years, nothing happened. So Abhiyan is replaced by Aswasan Assurance. So it started with Abhiyan, ended with Assurance, like that you can remember. Abhiyan is in PM SMA, Aswasan is in Suman. Next thing is, in Suman we have 5 programs. So what are the program under Suman? Let's revise it. This is an old program, we will read about it. So in Suman, one is JSY, Janani Suraksha Yojana, where money is given after delivery, we have read. Other is JSSY. Then there is Lakshya. Remember, black color mother and child, improvement of facility in labor room delivery ward. Then there is Dakshata. And the last but not the least is PM SMA, Pradhan Mantri Surakshit Matritva Abhiyan. What is Dakshata? Dakshata means highly skilled. So in Dakshata, government is going to give training to doctor and nurses. Why? The training is given to doctor and nurses to decrease neonatal death and delivery related complication. Okay. So this is the reason, neonatal death and delivery related complication. This is just a training program to prevent neonatal death and delivery complication. Okay. What is this Lift Kara De logo which is shown here? Rashtriya Swasth Bima Yojana. This is an old insurance program which started under Congress regime. And in Rashtriya Swasth Bima Yojana, there is 30,000 to 1.5 lakh insurance to BPL family. Okay, so this was for BPL family, maximum limit 1.5 lakh. Now this is no more. Now we have Pradhan Mantri Jan Arogya Yojana, which is written here, PMJ. PMJ come under Ayushman Bharat. And this logo has been asked in MCI exam just 1 year back. Ayushman Bharat has 2 components. One is PMJ, other is Health and Wellness Center. So let's first read about PMJ because that's what being asked. PMJ is 5 lakh health insurance after admission in hospital, and it is after hospitalization this insurance will work. Is it for private hospital or government? It is for both private and government. Because unfortunately in India even government hospital is not free. So this assurance work both. For both private and government hospital, which type? Secondary and tertiary level. Because primary level is sub-center PHC, which is mostly free. So it work at secondary tertiary level. Now it is for BPL family or economically weaker section. PMJ is for economically weaker section who are earning less than 10,000 per month for 5 people family. So for economically weaker section we have PMJ, and BPL also get benefit of PMJ. And for separately for BPL in the earlier time in the Congress regime there was Rashtriya Swasth Bima Yojana which we read. So this is PMJ. What is Health and Wellness Center? In Health and Wellness Center, government say that 1.5 lakh sub-center and some PHC will be updated, will be upgraded. And after upgradation, some added benefit will be given. So what are the added benefit? One is the NCD. All the diabetes, hypertension medicines will be given, which is still given, but government said we will give it. Definitely it is still given in most of the sub-centers. Then they add that we will give psychiatry or mental health benefit. Mental health. And then they said we will also give ENT facility and dental facility. But ENT and mental facility are not even at community health center. So they all ask, how is it possible, sir? How will you make us reach to 1.5 lakh sub-center when we are not at CHC? So government said that sit down. We will give yoga and meditation. And yoga se hoga. Yoga will take care of mental issue and ENT issue. So these are the 4 new benefits given at Health and Wellness Center which come under Ayushman Bharat. Okay. Do remember it. Now, next question is based on this logo. This is the logo of Niti Aayog. 2 questions has come from it. First question is that what is the full form of Niti Aayog and which organization it replaced? So Niti Aayog stands for National Institution for Transforming India, and this national institution, and do remember the full form, Transforming India, and it replaced Planning Commission. Okay, Planning Commission was in India since 1950 to 2014, and it used to give 5-year plan and all, and there were all corrupt people of Congress under it. So when BJP came enter power, they said, hey, all you corrupt people of Congress, go away. Now our corrupt people will work. And they replaced Planning Commission with Niti Aayog. So this is basically a think tank. It gives idea and opinion to government that how we can increase private partnership in government organization, and it give other technical advices. Okay, so do remember this is Niti Aayog logo. This is the logo of National Leprosy Eradication Program. I was teaching in one of the class, a student says, sir, in this logo there is both Congress and BJP together. I said, very good. So do remember they ask the criteria for elimination again and again. So there is 3 things for which we need to know the elimination criteria. For elimination of leprosy, the criteria is less than 1 case per 10,000, not 1,000 per 10,000. But similarly, they can also ask criteria for elimination of filariasis and criteria for elimination of neonatal tetanus. Okay. Filariasis and neonatal tetanus, for their elimination, there should be less than 1 case per 1,000. Okay. So filariasis, neonatal tetanus per 1,000, but leprosy per 10,000. One more question which has came is, in leprosy, what is the drug of choice if someone develop lepra reaction? So for lepra reaction, the drug of choice is methylprednisolone. Second question they ask is that if suppose a patient is on treatment of leprosy and he developed lepra reaction, so will you stop the treatment and give methylprednisolone, or will you continue the drug and will give methylprednisolone? So the answer is methylprednisolone is given along with leprosy drug, along with treatment of leprosy. We never stop treatment and then give drug. We give the drug and also add prednisolone with it. Okay? So we not stop the treatment ever. Now, this was an older logo, Mission Indradhanush, which is no more in India anymore. Now we have intensified Mission Indradhanush 3.0. What is this? 3.0 is a newer version which include all the vaccine of National Immunization Program. Include all vaccine of National Immunization Schedule. Okay. Now, my question from all of you is, what is Indradhanush scheme? Do you know what is Indradhanush scheme? And of course, it is different from Mission Indradhanush. Mission Indradhanush started way back in 2015 around, and it was focused on 7 diseases. That's why Rainbow, Indradhanush. And 7 diseases is very easy to remember. 3 are DPT, 3 are those given at birth, OPV, Hep B, and BCG. And the last disease is measles. So these 7 are included in it, rest are not included in it. What is Indradhanush scheme? Do you know? Oh, Bindas is liking my teaching. Thank you, Bindas. Thank you for appreciation. Shukriya. So, can you tell me what is Indradhanush scheme? Yes, Bindas. Thank you for appreciation, bro. Love you. And everyone is hungry of appreciation. So, we should definitely appreciate ourselves also. And we should appreciate our parent also someday. And then they will appreciate you also more. And they are doing hard work. And they should. Anyway, so Indradhanush scheme. What is that? 7 days, 7 different color bed sheet. Where? In your bedroom? No. In government hospital. 7 days, 7 different color bed sheet in government hospital. Okay, so that is Indradhanush scheme. This is Mission Indradhanush, different. Similarly, they confuse you again and again with Ujjwala and Ujjavala, which is so simple to remember. Ujjavala. This has a jaw in it. You can see. Ujjavala has a jaw in it. And what is the function of jaw? Jaw catches food and digests it. So similarly, Ujjavala program is to prevent child trafficking and help in their rehabilitation. Prevent child trafficking and try to settle them back, their rehabilitation they do. Okay. Then there is Ujjwala. So Ujjwala do not have jaw, you can see. Ujjwala is free LPG cylinder for BPL family with one-time gas, and it is filled when it is given, but there is no refilling which is given. Free LPG cylinder with one-time gas for BPL family. So if you saw jaw, that is child trafficking, Ujjwala, free LPG gas. Ujala was a program which has never been asked and which will never be asked in future also. It is LED light promotion by government. Government give subsidized rate LED light to people. That is Ujala, brightness. But Ujjavala, do remember, being asked in last exam only in MCI. Okay, so very important area. So this is some confusing part which you have to remember. This is IDSP program, Integrated Disease Surveillance Program. Under this program, we report the cases coming to PHC to higher center, Integrated Disease Surveillance Program. And we have read it earlier that within how many time we should report an outbreak? Outbreak should be reported within 24 hours. Now, this is the question which came in NEET exam. This is step surveillance to know high risk population for NCD. Suppose I ask from all of you, which country have more high risk population for diabetes? India or Brazil? India or China? Which will have more high risk case for diabetes? You can guess, but if you really want to know the real data, what you should do is that in step surveillance, we will select 5,000 population randomly from Brazil, China and India. All 3 countries, we will select 5,000 people from them. And we will go to their house and we will ask 3 levels of question. The first level of question here, the first tier is the psychological question. And psychological question can also be called as behavioral question. So which psychological or behavior thing can cause hypertension, diabetes? Of course, we will ask about smoking, that can lead to hypertension, diabetes. We will ask about the little alcohol. We will ask about the diet, which I took over. We will ask about the exercise, which I do only for 15 minutes. So all those things they ask, है ना, and that too some time only, है ना, like 4 or 5 days in a week, है ना. So that is there. So psychological or behavioral they will ask first. Second question they will ask is physical factor. Physical factor, we will ask age. If age is more than 65 years, you are at risk of diabetes anyway. Second, they ask, we can have the BMI, and BMI is also known as Quetelet index. So they can confuse you with the word Quetelet index. And remember, if they ask about BMI Asian classification, Asian less than 23 are normal only. If you are between 23 to 25 BMI in Asian WHO classification, you are pre-obese, and more than 25 is obese in Asian WHO classification of BMI. Okay, so just an extra point. Physical factor is second thing they ask. Third thing that they ask is hormonal factor. And hormonal is also known as biological factor. So the question which came from this part in NEET exam 2 years back, that which factor is not included in step surveillance guideline? Option A, is it behavioral factor? Option B, is it therapeutic factor? Option C, is it psychological factor? Option D, is it physical factor? So of course, psychological behavioral is added, is asked. Therapeutic is all, hormonal is also asked. Physical is also asked. But therapeutic factor is not asked. Why therapeutic factors are not asked? Because when we are dealing with hormonal or biological factor, we measure usually random blood sugar. And they have asked this question. At sub-center, which testing is done? Fasting or random? Random blood sugar is done at sub-center and by ASA. And therapeutic factor are not asked or not taken in step surveillance. Why? Why therapeutic factor is not taken? Because we are doing this not to start treatment. We are doing step surveillance only to know the high risk population. So in country like India, only random blood sugar is done. In some UK, USA, they do lipid profile, thyroid profile. But the purpose is only screening. Purpose is never treatment. Okay? So do remember, behavioral factor is included. Behavioral is same as psychological. In the explanation of this question, one of a person said, a good teacher said that behavioral factor are not included in it. But if you Google it, the WHO step surveillance, they have written that behavioral factor is included and asked. So behavioral they ask because it is same as psychological. Therapeutic they don't ask, especially in developing country like India, it is not asked. Okay. In developed country also, they consider it as hormonal or biological factor because it is for screening, not to start treatment. Okay. So do remember three things which is being asked: psychological or behavioral, physical, biological or hormonal. And in hormonal, we ask random blood sugar. Okay, chalo. Now, oh, this is Beti Bachao, Beti Padhao. This is awareness program on female, of course, increasing female education. And this is just an awareness program. Okay. So, let me ask you a very good question which has been asked. What is sex ratio? If they ask adult sex ratio means number of female by number of male multiplied by 1000. Okay. And the sex ratio of India is last calculated in 2011 only, and it was 942. Some data says that sex ratio has improved. Without census, we can never know about sex ratio. And I cannot go to, let's say, Northeast, one state, and I can say that, okay, sex ratio is good in whole country because it is good in Northeast. We need to do the census, the survey of the whole country, only then we can say sex ratio is improved. So the question which came from this part was that if sex ratio is more than 1000, then which one is correct? which is correct? Option A, male. The full question was, if sex ratio is more than 1000 in a population of 1 lakh, population of 10,000, no sorry, in a population of 10,000, that was the real question, then which is correct? Option A, it means female is more than 500, or option B, it means female is less than 5,000, or does it mean male is less than 500, or does it mean male is less than 5,000? So which thing indicate correct answer? Please try to answer it, try to guess it. For this type of question, what we have to do is, there is 2 steps which we have to follow. In step 1, we will divide population by half. Population is 10,000. So if you divide 10,000 by half, it will be 5,000, 5,000. And sex ratio is more than 1,000. More than 1,000 means female should be more than half population, or male should be less than half population. Only then we can say that sex ratio is more than 1,000. If sex ratio has to come more than 1,000, you have to multiply it by more than 1, na? So female should be more than half, male should be less than half. That means female should be more than half. What is the half population? Half of 10,000 will be 5,000. We have discussed it. So female should be more than 5,000, or male should be less than 5,000. So the correct answer is option D, male less than 5,000. Of course, I agree with you. If it is less than 5,000, less than 500, will mathematically that will also be correct. But we don't have to go on mathematics. We just have to divide the population into half. Male should be less than half, and female should be more than 5,000 for sex ratio more than 1,000. Okay? So very good, Veer Singh, you are right. It is D, and you are right. Now, let's move ahead. Dr. Raghav Pandey is saying that in ESI, daily bedsit is being changed. Very good. Somewhere it is being done, so it is there. Niti Aayog, we have already discussed. It is transforming India. It replaced Planning Commission. From this logo, they have asked this question, that where do you see the adult form of hydatid cyst larva? This is the life cycle of hydatid cyst disease. Hydatid cyst, adult form, option given are, is it in SIP, is it in dog, is it in human? So hydatid cyst, adult form in dog. Sorry, it came out. So in dog we have the adult form. Why they ask this question? This is, you can see in this part of the cycle also. Adult form is written, it is in dog, in a small intestine of dog. Okay. Why they ask it? Because what is the characteristic of adult? Adult do sex. So adult means this is the main host. Main host, because it means that sexual life cycle occur in it. Main host means hydatid cyst, sexual life cycle occur in it. Wherever sexual life cycle occur, that is the main host. Main host of hydatid cyst is dog. Similarly, if they ask main adult host of adult part in toxoplasmosis, that is cat. Cat have adult form. And if they ask adult form in malaria, where do sexual life cycle occur? Of Plasmodium. Answer is mosquito. Why this question? Because human are main host of many disease, but in 3 disease, human are facultative or secondary host. In 3 disease, human are facultative host. Facultative means in which asexual life cycle occur. Facultative host or intermediate host or asexual life cycle host. Okay. So that's why they ask this question, that where does asexual life cycle of malaria occur? So asexual life cycle in case of Plasmodium, this asexual life cycle occur in RBC of human, and RBC of human asexual life cycle occur. In 3 disease, human are secondary host. What are those 3 disease? One is hydatid cyst, one is toxoplasmosis, one is malaria. In 3 disease, adult form are present in different animal. Hydatid cyst dog, toxoplasmosis cat, malaria mosquito. Okay, so do remember. Of course, this is microbiology part, but I moved because they ask it. One more question that they ask is that there are 3 type of life cycle: cyclodevelopmental. Cyclodevelopmental means the parasite only grow inside host, they do not multiply. Only grow, don't multiply. This life cycle occur in filariasis. Filariasis have a larva, microfilaria larva. That life cycle is cyclodevelopmental. Second type of life cycle is propagative. Propagative life cycle means they only multiply, do not grow. And this type of life cycle occur in case of Yersinia pestis. And they have asked this question. Patient come with inflamed bubbos. What is bubbo? Bubbo means lymph node. What is the causative organism of inflamed bubbo? Yersinia pestis. So Yersinia pestis, which is causative organism of bubonic plague, lymph node plague, they live in rat. They live in rat flea, and there they only multiply. They do not grow. So very simple to remember. Propagative, P for propagative in plague. So P for propagative, P for plague. Cyclodevelopment in filariasis. And the last type of life cycle is cyclopropagative. So cyclopropagative means they will both multiply and grow. Both multiply and grow occur in case of only one Plasmodium. In malaria, they both multiply and grow. Okay. So P for propagative, P for plague, cyclopropagative in malaria, and developmental in filariasis. Okay, do remember it. Now, this life cycle being asked again and again, this is rat, and they will give urine of rat. So they are talking about which disease? Can you tell me? Leptospirosis. Rat urine, if they give leptospirosis. Drug of choice, doxycycline. Okay. Similarly, in recent NEET, they have asked, what is the drug of choice for pertussis, whooping cough, or diphtheria? In both of this, the drug of choice, let me sort it. Drug of choice for pertussis, diphtheria is erythromycin. But the question was not for adult. This is erythromycin, which is the drug of choice in adult. The question was, what is the drug of choice for these two in children? In children, the drug of choice of these two diseases, pertussis, diphtheria, is azithromycin. Okay, we also can give clarithromycin, but drug of choice is azithromycin. So do remember, erythromycin adult, azithromycin here. Now, next, they can give you this image-based question, which you can see a pig here, you can see an ardid bird here. This ardid bird is also known as heroine. And they can ask, who is the reservoir of JE? Is it pig? It is ardid bird, because in the image you can see maintenance host of JE is ardid bird. And human are dead-end host. What is dead-end host means? Dead-end host means if I develop JE and a Culex mosquito bite me, and after biting me, if he bite my brother, let's say, then Culex cannot transmit JE from me to my brother. Like in malaria, I think you all know, sporozoite enter in human. When a mosquito bite, a sporozoite enter in human. And then from a human, gametocyte is taken away by mosquito. And this gametocyte go sexual life cycle in mosquito abdomen, and then it enter into other human in the form of sporozoite. So that means it's not that only mosquito can cause malaria to me. I can also cause malaria to a mosquito. Rather, after that, mosquito will have chills or rigor or not, that is different. But I can cause malaria to mosquito because mosquito will take gametocyte and he will have it. And then it can spread it to other humans. So malaria can go from human to human, but not filariasis. That's why human are dead-end host. So who is the reservoir of JE? The reservoir of JE is same as maintenance host. Reservoir means maintenance host who keep JE during non-rainy season. So reservoir of JE is also ardid bird or heroine. Okay. So ardid bird is the reservoir which store it. And then there is Culex. Culex transmit JE 3 times being asked in MCI exam. Culex transmit 3 disease. JE, filariasis, West Nile fever. West Nile fever. And because Culex is the nuisance mosquito. It breed in dirty water. So you can remember it with this. Nile fever. Nile means sewage water, dirty water. So West Nile fever by Culex. And Culex is so talented कि ये उड़ती चिड़ैया के बम में काट लेता है. It bite in the bum of flying ardid bird. And after biting in the bum of flying bird, this Culex bite in the bum of suarva, and it bite in the bum of suarva, pig. And from pig, it transmit JE virus to human by transovarian transmission. So pig is which type of host? Amplifying host. Pig amplify JE virus. And when I was preparing, I used to remember it like this, that pig must be singing this song for JE virus. कि मैं तेरा amplifier है ना. Pig is the amplifying host, pig is the amplifier. Reservoir maintenance host, ardid bird. Human dead-end host. Okay. So these are some of the image-based questions which are there. And along with image-based, we discuss some important topics and question also. Before FMGE exam, I will come back again with 100 sure short objective question. I have prepared all those 100 questions. I will add some more question there, and I will come in a 3-hour session with 100 question. And if you include this image-based session and that 100 question, I'm very sure you will get around 70-80% your PSM question from these two parts. If you will revise them properly, 70-80% question will be from these two topics which I will discuss here, and in that 100 objective questions also. Of course, that objective question definitely include previous year, because 20-30% previous year is repeated. But there will be some new question also which can help you in getting good score there. So we will further come and we will help. Of course, I would love to discuss more probable question for FMGE exam and for NEET exam also. But of course, right now we are focusing on FMGE exam. So I hope you have enjoyed the session. If you have any doubt, any question, don't hesitate, just ask it on, this is my WhatsApp number and this is my email ID. You can share all your question, all if you want to abuse me, if you want to appreciate me, whatever you want, you can share it. And remember, in the email ID, this is DOC, Doc Ashwani, not DOG. It's not, it's DOC, not DOG. Okay. So let's meet in the next session where we will discuss the 100 probable question for your exam with this image, if you should integrate that. And till then, hasta la vista, dasvidanya. Keep enjoying your life. Bye-bye. Okay, bye-bye. Thank you so much. Sneha is saying, sir, please put some free video as well, letting us decide what to do. Definitely, dear. I will revise the whole session and it will be free of cost, definitely on YouTube for all of us. And I will put it, the whole revision I will try to put, but it is 9-10 hours. So I will summarize it in this image session and then 100 probable question. And it will be for everyone for sure. Love from Jasu. Thank you, Vaishor. Thank you, welcome. I really liked your response and it was very quick. And let's meet in the next session. Keep rocking. Bye-bye. Das ka dhaniya. We will meet again. Bye-bye.